I think it's so important to relate to other men.
Think about it, like the way that we met, it was kind of just like DM. We slid into each other's DMs. If every time that you went to go get a donut, like somebody slapped the shit out of your face, that's an immediate action that goes against what you want to do.
Because I feel like dudes are so. My bad.
Yo.
My bad. Did you just say? What did you just say? Can you repeat that? The first group fitness class.
The first class at Orangetheory that I taught, it was I was like literally in the bathroom. 8:15 I had to teach Sunday, and I was like, I'm so nervous. I was like 19 years old.
So you started in the fitness game how long ago? How old are you right now?
31.
31. So you were teaching at Orangetheory at 19.
I think 20. Because I had my 21st birthday like 3 months after teaching. Yeah.
And why did you choose to go to Orangetheory out of all places?
They chose me.
How so? They just came seeking you or what?
So I mean, I knew the owner from when I started working in the gym industry at age 18. And then after working for a while, I became a personal trainer like 19. And he just found my contact info. I got referred, I think, from a guy, Scott Schlesinger, that I worked with at the gym. Mm-hmm. And he texted me, and I called him back and I said, I heard you were looking for my services. And he's like, hey, Juan, nice to hear you again. Like, you know, because I hadn't talked to him in like 2 years.
Okay.
So he took me to like a big secret meeting that we were having out of his Pilates studio. Mm-hmm. And it was pretty funny because it was like 3:00. The shades were down, and it was like a secret, like, we're bringing something big to the Pinecrest community. It was like the first time that really group fitness outside of spinning was brought into that area. Mm-hmm. And Orangetheory really had like I don't know, they changed the game. Yeah. Now like they're everywhere. Like there's an F45, there's like a bunch of things in Pinecrest area, but like back in 2000 and I think that was 2012, 2011, when Orangetheory first opened up. We were Studio 22.
Orangetheory, it was like the first boutique style gym that was
that was like accessible for everybody, that like actually brought people in. I think other people were probably doing boutique, but more like 10 people, 12 people, and they were calling that boutique fitness. But they were the first to really do it in a big way.
They started in Del Rey, right? Or Boca?
Cooper City. Cooper City, I believe.
That was the first location?
Yeah, so it was based off of Ellen's Ultimate Workout that turned into Orangetheory.
And Ellen is the founder?
Yeah.
Do you know her?
Personally, I've met her like 3 times.
That's awesome.
4 times.
And now Orangetheory is global, though.
Yeah, 100%. International, it is, I think they had, when I left the company, it was like 1,600 studios in the U.S. And then I didn't know how much they had global. But I taught in Australia.
You taught in Australia?
Yeah.
You got to go to Australia because of Orangetheory?
I got to go because I had a connection, and then I got to teach over when I went to go visit in Australia. It wasn't that Orangetheory invited me over. I kind of like finagled my way into teaching a class.
That is awesome.
Yeah.
That's awesome.
Yeah. That was on my last year working for them.
What do you think about that model makes it so successful? What is it about the Orangetheory model that makes it so successful?
They applied a very easy model to reproduce to something that was fun. They put 12 treadmills next to each other, have everybody doing the same exact thing, and they put the heart rate monitors on with a kind of a feedback for the person, right? So we're very visual creatures, and when we see like, oh, get into the orange zone, like that's what I want to do, and then you see that thing blink orange, you're like, yes, I'm successful. Yeah. And you get like these like
splat points.
Yeah, the splat points. Like I got to get 20 splat points back. I don't know what they're doing now, but back when I was doing this, you had to get anywhere from like 18 to 20 splat points or something like that to say that you had a successful workout. So people were just like seeing that like, ding, oh, I got another splat point. Ding, I got another splat point. And like it's just these little gold stars that you get on your forehead, like as rudimentary as it sounds, but like it does something for you, and you're like, I want to do it again. I want to get that, that positive.
Yeah,
feedback.
That feedback.
Yeah.
The first time I went, I remember feeling like, wow, they're tapping into something a little bit different than a lot of these other gyms are. Not only you have the visual feedback, you can see how many splat points, you can see other people in the room.
Yeah.
And then I would kind of identify, wait, who the hell is Sarah? Sarah's killing it up there. So I'd look around the room to see which woman was like just gutting it. And I'm like, I got to catch her. That's the one. Mm-hmm. But that's just the competitive nature of some of us, right?
For sure.
But then the cool part is you could also compete with yourself. And then upon leaving, you get an email right away that tells you how you did.
Yeah, exactly.
So I think it's the constant feedback.
And that definitely developed as the company grew too, because I was at Orangetheory when they first opened up, and they had us writing our own workouts. Like, we would write our workouts on a whiteboard with a marker, and like you'd come to the floor and like do these like Juan's blocks, and then you'd go to the treadmill and do Juan's runs. Like, we had different instructors that did kind of their own thing, and I think they did a good job at kind of making it reproducible. Like, they made sure that after a couple of years of that kind of model, certain things happened in the company that maybe they didn't want to put the company at risk. So they, what's it called? They standardized everything and gave everybody a workout template to follow.
Gotcha.
Yeah.
Yeah, because some people might make everybody push too hard. I think they also had to change the limits of each zone. They actually had to lower it because they had multiple. And I'm a believer in Orangetheory. Orangetheory, if you can give me a free life membership, I'll take it. But I definitely know that there was a couple of cardiovascular events. Obviously, when you have people who are sedentary.
Yeah, it happens everywhere.
Yeah, they're sedentary. They're coming into a gym. They want these crazy, quick weight loss schemes. Yeah. And then they're pushing themselves to the limits. And they've been sedentary for 20, 30 years. Guess what?
It's going to be rough.
Yeah, you're going to have a rough time. And you might have a little clot that shoots off into your brain, or
you need to know where the AEDs are for sure.
Yeah.
Yeah. But I mean, it's rare.
Yeah.
I don't think it's ever happened to me in my class.
Oh, I hope not.
The most I've gotten is people falling off the treadmill.
I never want to use CPR and AED in a gym in my life.
In my 12 years teaching group fitness, never had to use an AED.
Awesome.
Haven't done mouth to mouth.
Good. Good, because mouth to mouth is no longer recommended. It's just
Correct.
straight compression.
Yes.
So good. I'm glad, Juan.
Yeah.
You're up to date, man.
Exactly.
So tell me, so before we go on about like group fitness and stuff like that, tell me a little bit about like your upbringing.
I don't know. That's all good. My upbringing. Okay.
Yeah. Like just your childhood. Because I guess where I'm going to get to is just so that you know where I'm going with this. So you don't feel like, well, what the hell's going on?
I got ambushed. Like, this is a session for you.
Please reveal your childhood traumas right now.
God.
No, some things that maybe people don't know about you, where you grew up.
Okay.
Where are your parents from? And yeah, let's start there.
Okay. I'm 100% Puerto Rican, born over there. I lived there till 94, 95. And I came over here during Christmas-ish time.
How old were you when you came?
4 or 5.
Oh, okay.
I don't remember 100%, like 4 or 5.
Right.
Yeah. We came over here. We grew up we first went to like Winston Park, like that Kendall area. Okay. Stayed there for a little bit. Then went over to the Falls area, stayed there for a little bit. And then we moved down to the Cutler Bay area. Awesome. So pretty much raised in Miami, born in Puerto Rico. Okay. Both my parents are from Puerto Rico. My entire like family lineage is from Puerto Rico until Spain. I don't know. Until the Spanish conquistadors came over.
Do you go back to Puerto Rico often or no?
No, I went back for my half-ironman. It was the first time I've been back in like 8 years.
Freaking half-ironman.
Yeah.
We'll get to that too. I'm gonna write down a note here.
Come back to half-ironman.
Yeah, because that's brutal.
Yeah. But so I grew up in Miami area, went to Palmetto Middle School, went to Vineland Elementary back when I was just till 5th grade, Palmetto Middle School, then South Miami Senior High, then went to FIU for my undergrad, and then I went to University of Miami for my doctorate in physical therapy.
Awesome. And then while you were at Orangetheory, you were in PT school?
Yeah, so I got into Orangetheory in 2011, 2012, and it was my second, I believe, third year of undergrad. And from then on, I stayed with the company for 8 years, I believe.
Wow.
Yeah.
Did you always know that your end goal was physical therapy? Was that something since high school that you just knew?
No. I wanted to do mechanical engineering first, and then I wanted to do civil engineering, and then I just didn't want to do either. Too much math.
Where did that transition happen? Was it just the course load or what?
No, it wasn't the course load. I didn't even make it out of high school before I knew I kind of wanted to go into like the fitness industry / health industry. My aunt's a physical therapist, so I always did like the take your child to work days with her.
Okay.
And I was doing like ultrasound on people when I was like 8 or 9 years old under supervision.
That's awesome.
Yeah, it was like just put the little transmitter on there and just keep on going. Don't stop. Whatever you do, don't stop. And that's pretty much it.
So your aunt was a huge influence in terms of why you became a physical therapist?
Yeah, I knew I wanted to help people. I knew that she helped people on a daily basis, and I mean, I just always saw it growing up, so I figured, why not? went into it, and I loved it. So I just continued to do it.
What did you learn at Orangetheory? Or, I mean, you've worked at Orangetheory, Kamps Fit, Antidote, ERA Fit,
Barry's
Bootcamp.
Yeah.
What have you learned because obviously you've learned from school, from a literature, reading the literature, right?
Yeah.
But what have you learned about human behavior, about people's drive, their motivation? What have you learned, anecdotally in the gym?
Yeah, I mean, everyone has different motivators. Everyone has different ways of interpreting the information you're giving them. You can say one cue to one person, and it's not going to work for the person next to them. So you have to continue to like trial and error. You know, like some people want you to push them and scream at them and all this stuff. So, but most people don't. So like I've learned in group fitness, when I would yell at somebody, scream at them, or whatever it was always off the mic, because I don't want the other 35 people in there to listen what I'm telling you to motivate you. And then I would say what 80% of the people would want, which is like find your inner motivation and then harness it and then push it. But there was always that like 20 to 30% of the people that wouldn't work for them. So it's like go up to them and give them what they need. And that only comes with experience. Whether it's to ask them what motivates them or you just figure it out. Like sometimes it would be someone's favorite song. So I knew I would see that person on the rower, like just dying. And then I would go to my playlist and I would be like, this person likes this song. It's going to get them to push. Bop, put the song, and then you immediately see their face or they see their body language changes, and you're just like, that's it. And so those small little moments make teaching group fitness very unique because if you're looking for them, you find them and they fulfill you.
So do you feel that a rookie trainer or somebody who's more inexperienced would struggle identifying that?
Yeah.
Like when you were brand new, you didn't identify like, oh, this person needs to be yelled at. This person needs a song to trigger them. This person needs to think about their inner drive.
No, yeah. I mean, so it was new. When you're new, you kind of just fall into the cliche sayings like, you miss 100% of shots you don't take. Mm-hmm. Go do it. Like that kind of stuff. You're kind of just trying things out, trial and error. But I think when I was new, I said all the things that I needed to say that were in the script for OTF, but I did a lot of things off the mic and talked to people off the mic a lot and found out what made them tick off the mic a lot. And that's what helped me out and helped me build more of a following. That, and I would always show up. No matter what, I'd always be there. I'd never call in late. I never call in sick, whatever it was, I always showed up.
Yeah, you were telling me that you were waking up at 3 a.m.
Oh, yeah, that was...
undergrad or was
No, that was grad school.
Grad school.
That was a completely different time.
So where did you find... Why did you have to wake up at 3 a.m.?
So I taught 4:30 in the morning at Orangetheory. I think we were the only studio to teach like the earliest class in the company for a while.
People show up at 4:30 in the morning?
At first they don't. No, at first I had maybe like 5 or 6 people. Within, I feel like 2 months, 3 months, the word got around and people kind of stuck with it. And really at that time in the suburbs, that's the only time that moms have to themselves. Like everyone's still sleeping in the house. And that's kind of, I'd say 70% of my clientele, 80% were moms. And it was a time for them to just use it for themselves.
Yeah, escape the house. Yeah. Their kids are still sleeping.
Everybody's still sleeping.
Get their workout in, and by the time they get back home, they start their day. They wake up their kids, make breakfast, take them to school.
Yeah. Biggest confidence boost for me, though, was during one of my rotations. I had to give up one of my classes. I worked in downtown, and so I wouldn't be able to make it if I taught the 5:30 a.m. So biggest confidence boost was I only taught 4:30 in the morning, Monday, Wednesday, and Friday. And my 4:30 in the morning class had more people than 5:30 in the morning and had wait list over 5:30 in the morning. And so people were willing to wake up extra early
to go to your
just
class.
To take the class. Yeah.
Actually, now that I remember, the only reason I ever started following you on Instagram was a fellow professor when I was at the University of Mami named Karina Gatamura.
Oh, yeah.
And she was like, yo, this guy Juan, he's really cool. He's actually and I don't remember why we started talking, but I had just started going to the Orangetheory in the Gables.
Yeah. That was back. Was I still teaching in the Gables at that time? I taught the Gables for like a year and a half.
I think you would once in a while. You would drop in, but I'm not sure.
Yeah.
But yeah, funny story. And then that's when I guess I reached out to you, and we just had like a back and forth for a while on Instagram, which is something that I bring up to people a lot. No, I think it's a good conversation just because men I've been stressing men's relationships with other men.
Yeah.
You know, I think we're prideful. Men are prideful. We have our egos. We have our machismo. We want to do it on our own. We want to be independent.
Yeah.
And the older I get, the more I realize like these small connections that you make with other men who have the same drive, the same outlook on life, the same values, and the fact that you wanted to help people. I think it's so important to relate to other men.
Yeah, I agree.
I don't know where I'm going with that, honestly. I just feel that it's important to stress it because I feel like dudes are so caught up in their bullshit.
If you think about it, like the way that we met, it was kind of just like we slid into each other's DMs.
It's true.
It fucking worked.
True story.
Yeah, and
actually, my ex-girlfriend at the time made fun of me because I remember
because it was super weird that you were gonna go have dinner with me, or not dinner. We
went to Tap and
Tap 42 after
we were gonna go to the
workout.
Bar, and I remember,
was it after the workout or before the workout?
I don't even remember, but she like gave me shit for it, and I was like, "What's the big deal?" Like I'm gonna go meet him. He's a cool guy. We're sort of in the same field. We're both into fitness. But she was like, "Oh, that's weird." Blah blah. That's probably why she's my ex. Shout out to you. My bad. My bad. Cheers. I don't know. Shots fired. Hey, good people. No, for real, good people. It was just that interaction.
We wouldn't be where we are today without our exes.
Sure. The podcast just took a turn, huh? Guys, I'm not trying to be mean. I'm just stating the facts. That's all it is. It's not good. I have no animosity towards anybody. Yeah. I just thought it was weird because if my girlfriend tells me, "Oh, I met this girl, blah blah, we have similar interests, we're gonna go meet up," cool,
go for it,
enjoy.
Yeah.
But then the fact that I was getting shit, I started to realize how there's those gender roles that exist.
Yeah.
And then
we call that a double standard.
Definitely a double standard. No, and we also know that middle-aged men are the largest demographic of people who are living extremely isolated and have the highest levels of loneliness. So it's a problem that exists in the literature, and then me living it is why I keep on bringing it up, because men definitely need to establish strong, solid relationships with other men. Yeah. It's all good, whether you're playing ball, but as long as you have somebody else to relate to. Like right now, my boy is Alex, right?
Yeah.
And Alex, actually, as a result of the relationship I had with you, was the fact that you helped Alex step into the role of a trainer, which is pretty dope, right?
Definitely.
So again, it's these connections that you make along the way, and you have no idea where they're going.
Yeah. You have to nurture them for sure.
You definitely have to nurture them. You have to step up. You have to show your own drive, but at least that bridge is there. Mm-hmm. So anyhow, So you've gone the non-traditional route as a PT, right?
The cash-based practice.
Yeah. Well, not just cash-based, but most physical therapists graduate and they go into a hospital-based system or a bigger clinic setting where they use PTs, PTAs. I know that initially you try to go off on your own immediately after graduating school. Yeah. Did you try to go the insurance route initially?
brief moment of my life where I lost a lot of money just taking insurance, because I think it was too much of a headache for me to deal with, and I didn't have the money or the funds to hire a third party to do all the billing for me, and just kept on getting denied with your submissions and claims, and I was like, this is dumb. I'd rather just care about my patient, charge what I charge.
So why didn't you so that failed, right? You start a business.
It was a trial, and it didn't go the way that I wanted it to.
Okay, it failed, Juan. It's okay. So if it it didn't go the way I wanted,
the business model took a different route.
There you go. So when something like that, when you hit a brick wall, right, like that, what made you not decide to just? A lot of people would just say, "Oh, this isn't going to work. Let me just go the traditional route with the rest of my classmates. They have a solid salary. They have insurance. They have benefits. They have a 401k." What made you decide, like, I'm still going to keep moving forward?
I don't want to work on somebody else's time.
Got you.
I don't feel like someone should have aside from my wife, a decision as to what my time is used for. And I don't know. The independence of working for yourself and being an entrepreneur is important to me, and I'm the only one that's responsible for my success and my failure, or business plan direction change.
Gotcha. But I guess my question is,
why didn't I go just try to get a job somewhere? Yeah. I think that I always had a feeling that this kind of model would work, and if you care enough about your patients, you just have to stick in it long enough to get a patient base, and then from there you just continue to grow. I have a firm believing that insurance-based PT is tough and kind of dying almost. Like the people that actually care about their body and want to learn more about it and really dive into it are willing to pay the rates of a private practitioner just because they know they're going to get the one-on-one care and they're not just going to get what's reimbursable. Like I shouldn't have to be forced to put ultrasound on you or to put a hot pack on you just because it's going to give me $12 of reimbursement when I submit it. Like why? I know that's not going to do anything for you. I know that passive modalities don't do shit. So like why would I put that as part of your care? Unless you were in like a lot of pain or something like that, and I could make that better for a little bit and then take you into the other stuff like the dry needling that I do.
Yeah.
I can get you out of the current pain status that you're in, but our treatment plan is movement based. It's movement is what's going to get you to where you want to be. It's going to get you to your goals, not sit back, relax, and give you a masajito.
Yeah.
But that generation of mentality, I think, is kind of just going away.
Do you really feel like it's shifting? I mean, that's a major industry right now.
Look at my clientele. In my personal case, it is, I guess. I just see it more on Instagram. I see it on social media. People are using movement to get better.
Yeah.
And when you see that that's where the trend is going, then I can firmly believe that that's where it's going to go.
Yeah. I wish I would have brought my bills from physical therapy
From the hospital?
the first 2 months
Yeah.
After my surgery recently.
Yeah.
When I started to look at it, I was like, wait, what the hell are they charging me for? Like, what's going on here? But I think the same is true across the industry in terms of healthcare.
Mm-hmm.
Like if you show up at the hospital, the hospital is the only place where you can go to receive a service, but have no idea what the cost is going to be until after the service has been delivered.
You're right.
Isn't
or you can go to like a shiesty salesman.
That's true.
They get you to sign on the dotted line, and then you're like, oh, I have to pay all these extra fees.
But it's the same.
Yeah, yeah.
It's the same. Like you have no idea. So it's a shame that I have insurance. I go to get this treatment done. I know the treatment that I need. And I could even tell them, hey, give me a CAT scan, give me an MRI. I need 2 5 milligrams of Tylenol. I need an IV bag.
And how much are you going to pay for those 2 5 milligrams of Tylenol?
Probably $50 a piece.
Yeah.
Unfortunately.
No, but your insurance pays for it, right?
No. There's always a deductible. There's a copay.
Yeah, that's what I'm saying.
There's extra costs that come afterwards. So
it's like a scam.
It is a scam. Unfortunately, it's a scam. And so, yeah.
I'm a firm believer in that.
So I was recently on a cruise. And while I was on that cruise, I kind of remembered the movie WALL-E.
Yeah, that's a good movie.
It's an awesome movie. And the way
I know exactly what scene you're thinking about.
Yeah. So the WALL-E at the very end depicts a scene where everybody is morbidly obese. They are living on these little cruisers that take them around. They are having fast food, and they are doing nothing that requires physical activity.
Mm-hmm.
And it was the same. The same was true on the cruise. The cruise has these buffets that are amazing, full of food. But then you start looking at the plates of food that everybody's choosing. They're not the best choices.
Yeah.
I start looking at the actual people, and I could, regardless of obesity, I could see peripheral vascular disease. I saw people literally on the cruise on scooters.
Yeah.
I went to the gym.
Empty.
State of the art and empty. Badass gym.
Yeah.
With views of the ocean, right? Empty.
Maybe people are just scared of heights in the ocean.
Yeah, I doubt that. So, and then people give me the excuse, well, they're on a cruise, they're on vacation. I'm like, no, these people, they're not moving, right? What is going on? Like, what is going on in terms of where we're going to as a society? What can we do about this?
Dude, I don't know. I can't answer that question. No, man. As things get easier for us, things get harder for us to move, right? So like, even now, I'm tempted to buy a scooter. I drive to work. I live a mile away from my job. Mm-hmm. I drive to work. I feel bad about that, saying that, but it's true. But I mean, I do other things in my life to bring movement that I need. But I don't know. Technology keeps us sucked into this virtual world that makes us feel good with the same stuff that happens at Orangetheory, except on this small screen. Right. Mm-hmm. So we're constantly looking at the small screen, and if we can get all the pleasure in our life from a small screen, like why do I have to go get endorphin release from going to the gym? Why do I have to cause myself discomfort to feel good about myself. I can just get the likes on the screen. Why do I have to look a certain way? I can just kind of adjust myself with this filter and like be better on the screen. So as our life gets better on the screen, it gets worse and worse off the screen. And I don't know, that's kind of my first thoughts coming off that question. Why do I need to be fit? I don't see the immediate results of not being fit. Like peripheral vascular disease, that's not going to get you from this month to next month. It's going to get you when you're 40, when you're 50, when you're 60. I'm 20. Like 31. Why do I need to focus on it now? I don't. It's not impeding my health yet. So why? And if people don't see these, it sucks because people have to wait till those events to then get a wake-up call, or they still don't get that wake-up call after that event happens, or they get like an MI or something like that, and then they end up like trying to redo their life, but you kind of can't because you've already got the damage. So now you're starting off from like a negative standpoint instead of starting off at like ground zero. You're down under. So if people saw themselves 30 years from now, if they continue on the path that they're on, then I think they would change it. Or I would hope that they would change it, but the truth is I don't think they would.
Why do you say that? Why do you say if you could even show them what the consequences will be, why do you think that they will not change their behaviors or their actions?
There's no immediate negative side effect. If every time that you went to go get a donut, like somebody slapped the shit out of your face, that's an immediate action that goes against what you want to do. There's an immediate action to do to be on my phone, right? It's that immediate pleasure. But there's no immediate displeasure of doing something that's not good for you. But I don't think anyone can pay somebody to slap them. Well, they probably can.
Yeah, you probably could.
You probably could find something anywhere.
I mean, if you want, I'll do it for free.
You're right.
I'll do it for free. If somebody tells me, hey, every time I have a donut, you have the right to slap me, I'll have them sign a contract and I will be gladly.
There you go, right there.
I mean,
but I think that's probably something is that you don't get the immediate, I think, I can't think of the word right now. When I'm on the microphone, I can't think of the right word.
No, that's okay.
Yeah. But,
like it's well established that people who are active and fat or active and overweight is much better than being thin and sedentary. Yeah. So it's not even, I guess what I want to stress
because you're getting the blood flow.
Exactly.
You're getting your heart to pump. You're getting your heart to move blood throughout and keeping all of your vascular system limber, like mobile, versus being sedentary. None of that's happening. You're just like, things are hardening over time. And you're not pumping things in and out. That's all.
I'm looking at my notes here because I know I was going to go somewhere else, but I'll just go off on my own.
Yeah.
What do you think is one of
what we got to be able to reel you back?
Yeah. What do you think is the biggest pitfall so let's say you're obese or overweight.
Yeah.
What's the biggest pitfall or what's the biggest pitfall or myth or something that people fall into when they're beginning a weight loss program?
When they're beginning a weight loss program, they think that it's going to happen and it's going to be it's going to be easy. It's not going to be easy. You're going to be uncomfortable. You're going to be fighting okay, so let's talk about this. A weight loss program, take that off. Let's do something that everybody's done. January 1st, I'm going to start working out. January 1st, I'm going to change who I am. Like one day, like it's the same as your birthday. How old do you feel today? Like, no, I feel a day older than yesterday. Nothing changed from the 31st of December to the 1st of January. You didn't become more resilient. You didn't learn how to overcome adversity. You didn't learn how to go to the gym. Like, you're still going to have to put in that work every single day to get to the goal that you want to get to, right? And I think the biggest pitfall is that because someone pays a certain amount of money to do that weight loss program or pays a certain membership fee or gets a trainer or whatever it is, they think that they're going to see the results right away without any discomfort. And all that it takes is, I signed up for this 3-month package. I'm going to be, at the 3-month mark, I'm going to look this way. But they forget that they're the ones that have to put in the work the entire way through. It's not like you're on a skincare regimen that you're just putting lotion on your face and in 3 months' time, you're going to have these great results. I'm not saying that works anyway. doesn't work.
Yeah. So do you think it's more so a means of changing the lifestyle overall? And
Yeah,
how do you go about
it's
doing
falling
it?
in love with the process of that change.
But I'm tired of hearing fall in love with. Everybody tells you start a new business, fall in love with the process.
Yeah.
You're studying for a program, fall in love with the process. The process sucks, right?
Yeah, it does.
The process sucks. The process is difficult.
The process is uncomfortable. The process puts you in adversity, right? Like, and so love the person that you're going to be on the other side of that, but go through it. Don't just drop. Like, the reason you are the person after the 3 months, the reason you lost that weight is because you overcame adversity every step of the way. So if you want to fall in love with something, fall in love with the person you're going to be later, but you can't skip everything that it takes to fall in love. Like, falling in love is not easy. Love isn't easy. I can't describe it any other way. Like, if you fall in love with a person and it's too easy, I don't think that person's the one that you truly like. You have to wake up every day and make a decision to love this person, because that person's going to be one day mean to you. That person's one day going to hurt your feelings. That person's one day going to like not be easy to be around, right? Just for whatever they have going on. And you still have to love them for who they are, every aspect. So take that and put it into the weight loss. Like, you still have to love yourself along the way, but yeah, that's kind of where I want to do.
No, I hear you 100%.
Yeah.
I think, so what do you say to the person, who doesn't, they do have this desire, right?
Yeah.
They have this desire for change, but then as the days go on, every day it's like, I don't have the energy today.
Yeah.
I don't feel like it today. This just isn't working out. Tomorrow I'm going to do it.
Yeah.
How can we get people past those feelings and emotions that we all experience day to day? There's so many days where I have no desire to go to the gym, but I found a way to force myself to go.
What's your way?
I told Erica yesterday that I've gotten to the point where she didn't like the expression, but this is a whole nother discussion. I told her #fuck what you feel, but that's more of me, how I motivate myself. I understand that for a beginner that may be difficult because they might have a lot of other obstacles to overcome. There might be a lack of education, but for me, it's more so just the emotional aspect and getting over my own laziness.
Yeah.
And so that's what I've done. And it's just, I know that daily movement is what's going to help me in the long run.
Yeah.
It's a release for me. It's where I clear my mind.
Yeah.
It's where I make business decisions. You know, it's where I look at my love life. It's where I look at my friendships. It's where I look at my position in the world during that time, because I just feel that my mind is kind of sifting through everything as I'm going through it.
Yeah.
Or it's just an escape where I'm listening to Bad Bunny and hanging out. It just depends. Or pushing my friend, or having friendly competition with somebody else. Or it allows me to, we were just talking about it a little while ago, I exercise in the gym because if all of a sudden me and Juan are outside and Juan is like, yo, I bet you I'll beat you. So I have the ability to do it. Or all of a sudden, I don't know if you're planning to have kids anytime soon, but if you have no pressure, Juan, this is the pressure. Let the wife hear this. He's drinking water. Everybody zoom into Juan. No, I'm kidding. No, but let's say if you have kids, right? And I'm just hanging out with you and all of a sudden your kids want to play. I want to be able to get up and be mobile and move with your children.
Yeah.
Or play on the beach, whatever the case may be. I want my body to be able to function and respond, not only today at 38, but at 48, at 58, at 78, and if possible at 88 and 98, because I've seen it.
Yeah. I don't want to be
bedbound.
Yeah. That's not a way to live.
I don't want to be bedbound.
Yeah.
I just said it yesterday. I saw my grandmother's been bedbound.
That's what I was going to say. Like, you have a
yeah, I have a prime example.
Yeah, literally. Every day you go.
My grandmother's 6 years as a result of a stroke, not taking care of her hypertension. I mean, she tried to manage it the best that she could, but eventually Mother Nature caught up with her. She threw a clot. She was down for like 7 hours. I honestly thought I signed the DNR.
Yeah.
I wanted her to pass because I believed like her quality of life was going to be poor. Luckily for my grandmother, maybe it's her faith. I have to say it's her faith that she's still joyful when I go to see her.
Yeah.
She's still full of love. She's just happy to see. She just wants to give me a hug. She wants to try to conversate. But the fact that she's bedbound, still strikes me and is a reminder that, hey, yeah, you're mobile now, but if you don't take care of yourself, there are consequences.
Yeah, and I wouldn't want to be anywhere near that, because like during COVID, you were scared into staying into your own apartment, right? Like they told you not to go outside, all this stuff, and you felt like a prisoner. So could you imagine that 700 square foot? Well, I had 700 on the beach, but like imagine that now confined to a bed and your toilet and a bed, or for some people, bed and like a
commode.
A commode.
Yeah, she has a Foley, so that's it.
Yeah.
My mom is the one taking care of her. It's
rough.
It's rough, and it's not only rough for my grandma. It's rough for my mom, who's now the primary caregiver.
Yeah.
And it becomes rough on the family.
Yeah.
Because
you have to jump in there and you have to be in there and visit and all this stuff, or else you're not pulling your weight and all this. Like it's tough.
Yeah.
And you have to live your life and you have a business and all this, but then now you have to add in this extra component. And thank God you live here, because if you lived in California, you'd have to come and fly back and forth, and you maybe not would be able to do it. So then you have all this pressure stressing you out, and you have that increase in your cortisol levels, and you're gaining weight, whatever it is. Like there's so many different components we don't take into account. But the fact that you have someone in your family that's bedbound, plus the fact that you now use exercise to think about business and all this stuff, like you have all of these factors that are keeping you where you are at fitness wise, right? Mm-hmm. Was there any point that you, once you found out that made you tick, was there any point where you gained weight?
I mean, I've
fluctuated.
I fluctuated a few pounds, but nothing drastic.
That you can't control, nothing that you can't get yourself out of.
No, movement has been part of my life almost my whole life. Like I've always understood that this is something that I need.
Yeah.
And that's why I preach it so much,
Not having those cues and not having those things, it must be extremely difficult for someone who is overweight, or someone who doesn't have that feedback, or who their family kind of pushed them in that direction based on whatever food they had in the house. However the family ate is how they ate, and they just took that into adulthood. And then what happened from 18 to 19 when they moved out, or 22 to 24 when they moved out, whatever it is, like they just kind of kept those same habits, and like, this is what my pantry should look like. This is what my refrigerator should look like. It looks like how I grew up. This is what everybody's family's like. Mm. Versus if they did like one of those child swap things or whatever, like they do wife swaps, mm-hmm. and you go to a different house that lives in a different way, you could be like, oh wait, people actually live this way. This isn't normal. You just get out of your own little bubble and explore that.
Why do you think we're abandoning this so much in terms of education, especially primary education? We're abandoning.
Are we trying to get into conspiracy theories? Right
no, if you want to. But seriously, why are we abandoning physical education, nutrition? I won't even get into finances, but we'll stick to the physical aspects, right?
Dude, I don't know.
We're abandoning this altogether. We're not teaching kids these things, like you just said. If you only have one worldview throughout your entire childhood, it's really difficult for you as you get older to change that.
You can't. It's so hard. Yeah, you're right. I don't know why it's happening, and I don't know why more emphasis isn't being placed on movement and just movement throughout the day. Our workspaces have us sitting down all day, every day. Like standing desks are like a thing, but that's not anywhere near where you need to be. But you have your kids, like you're programming your kids to sit down. They go into work, they sit down. They have their lunch break at school, they have their lunch break at work. Like they're doing the same thing, they're sitting down. School is programmed to what work should be like, and you just kind of live your 40, 50, 60 years in the same position.
Sitting.
Damn it. You're setting people up for failure. Then someone who's sitting all their life, you tell them to go run, they don't want to do that. It's completely opposite. Their bodies aren't meant to run. Their bodies are meant to sit or lay down, sleep.
So how can people, so we're not being informed, we're not being educated, and then we're actually being misinformed, right? Mm-hmm. So how can people sift through all this misinformation that exists, that surrounds us, that we're engulfed in? How can we sift through and actually find the valid information and things that are tried and true and evidence-based that will actually help us either with fitness, with weight loss, or achieving our goals?
That's a tough question to ask, and I appreciate you for asking it. How can we do it?
Like, how can we sift through all this information? Where can somebody find solid information? Where can somebody find dependable information that's like, hey, this is realistic. This is what it actually is. And it's not this, like we were talking about, 8-minute abs.
Yeah, not the gimmicky, like, sales. It's tough because this is, like, this rules us, right? Like, the cell phone we interact with a piece of content, and now the algorithms say like, this is what you like, I'm going to bombard you with this, and you're going to continue to interact with it, and therefore you're always going to get this. So it's like going back to what we talked about with being a child and putting in a seated position in school, going to work. Like you're being stimulated by one piece of content that you interacted with, and therefore you're just going to continue to get that stimulus over and over again. So you can't get out of it. It's hard to find it on the phone. You just got to think about the people that actually care, like you, Eric, myself. Like these are people that want to spread the good information, don't care if they make a sale. Like obviously you need to keep the doors open, but like the sale is not the number one, right? So I'm not going to say things that like, I almost fell into that trap trying to do this Instagram stuff and like the 3 best exercises for low back. Like not really. I just got you to click on my stuff so that you could like stimulate my growth. And that's not where I want to be, because it's not true. Like there's no 3 best exercises for XYZ. Two of the things that you can do to bulletproof your knee. Like, no, it's not valid. Don't say that to people, because they're going to believe it.
And they're only going to do those 2 things, and they're actually going to weaken their knee. Well,
not necessarily weaken. You can strengthen it. There's only so much you can, but there's so many other things that you can do to help you that maybe not involve your knee, or not involve those 2 exercises, or those 2 exercises plus 8 other things. Like 2 exercises plus lose weight, 2 exercises plus gain weight, plus gain muscle, plus actually do a strength training program that's meant for you over the next 8 to 12 weeks, and see how that's going to help your low back pain. But it's not the 3 best exercises on Instagram. It's not the microwave ready solution that people are seeking, I think. I'm not sure if I answered your question.
No. Okay. I think most people do. We click on those things because it seems like easily palatable, easily digestible.
Yeah, I only have to do 3 things and I'll be good. Like I have no more back pain if I do these 3 stretches. Like the 3 best stretches for hamstrings.
Like you were telling me earlier when we were doing PT. You were telling me that the most purchased program is a 3-month program. Yeah. Why? Can you go over
I can see myself doing something for 3 months, but the second you tell me to do it for 6 months or more, it's like very tough for me to see myself doing something for 6 months. It's like too far away. 6 months. 6 months. That's a lot.
So you just feel like us as humans, we're very
more digestible. 100%. Yeah. If I work hard for 30 days, like 30 days, 60 days, like these things work, because if I work hard for this short amount of time, I'm going to see these results. I'm going to do it. I'm going to commit to that short amount of time. But if I told you, hey, if you stick to this program for the next 3 years, you're going to be in great shape.
3 years.
Yeah. How do you feel? You want to buy this program?
That's tough. I mean, I would.
It's a tough sell. Yeah. It's a tough sell. So, but hey, you can drive off this lot with this car. That's going to make you get chicks. That's going to make you get the boys, like whatever it is. And you're going to sign away 6-year lease for this car. You'll do it. $400, $600, $700, $1,000 a month for certain people in Miami. Yeah. Like, because it's instant gratification. You didn't have to struggle. You didn't have to sweat.
Yeah, it's just that luxury item that you boast, right?
You just went and did it. Yeah. So, but people specifically with like low back pain or like knee pain or ankle pain or whatever it might be, they gotta fall in love with the process. I'm sorry to say.
No, and the reason I just that phrase falling in love with the process, I just feel like it's heard so often, and I don't know if people actually understand that until they're part of that process, right? Yeah. And until you start to learn like, oh wait, I have to learn to enjoy this thing that's uncomfortable. Mm-hmm. I have to enjoy this thing that involves sacrifice. This is the opposite. Yeah. Because we want to enjoy the donut.
Of course.
There's no
the donut's nice.
The donut's nice. There's no nice. The donut tastes good. Yeah. It feels good. We enjoy it. We feel full. And
for a second. Then 30 seconds later, you're like looking for another one or looking for, it has no substance.
Yeah, it sucks. So what's, and this might be the wrong question. Go ahead.
So going back to like tying that all back to PT and like what I do is in that process, like let's say someone, they have a tendonitis and they have to be with you for 6 to 8 weeks or whatever it is because they can't control themselves. They're going to hurt themselves even worse, whatever, if they try to go on their own. I have to find small areas in their life that are success stories to give them those small little tidbits of instant gratification that the human body or the human mind wants.
Like what? What do you mean by that?
Okay, so let's go to tendonitis. Like, let's say the person has elbow or triceps tendonitis or whatever it is, and they're doing push-ups, and every time they do push-ups, it hurts, but they can do a chest press, and they couldn't do a chest press 3 weeks ago, but you got them to that point they can do a chest press. Like, that's a success. Like, that's a little carrot to put in front of them that they can continue to chase. Like, hey, you can do chest press, but you can't do push-ups yet. That's okay. But like 4 weeks ago, you weren't able to do anything without your elbow hurting.
Mm-hmm.
And now it only hurts when you do a push-up. Like, congratulations, you did great. Let's get a high five.
Mm-hmm.
Let's put an immediate like stamp on it. Success, gold star.
Yeah.
Like, you did great. And then they feel accomplished, and that helps them continue falling in love with the journey, because you just sometimes have to open up their eyes to where it's at. There's people that will never see that they've gotten better because they continue to try to find that like pain that they had before, right? So for me, the hardest joint to deal with is like shoulder rehab, because you're not shoulder, you're
No, pec. Yeah.
no.
Close.
Yeah, close.
Yeah.
But shoulder rehab, because sometimes the person can't reach up in this position. I'm like, that's probably the worst possible position you could be in, but they have all this available, and they came in like this.
So
And
they're
I'm
just looking for that little bit of
They're
range
like,
that they can't
it just
get.
hurts when I do this, and like, or it hurts when I do like that. I'm like, when in your life are you gonna be here that it's gonna stop your function?
Almost
Never.
Except
But
for
you
where
looked for it, so
Yeah.
you found it. Good luck. And you just like inflamed yourself, and now I have to start you back from here because this hurts now. It's okay.
But I think it's the
happens.
same with all of. I mean, I can only speak for myself,
Yeah. That's
right? I tend to fix. I don't celebrate my small goals, my small victories as I go through my life.
Because you don't need it. Or what? What do you mean, like small goals in
So
life in
let's
general?
take, yeah, in general. I'm
Okay,
saying
okay.
like graduation,
Okay.
passing a certification exam, or opening a business, or starting a podcast. I just kind of keep going, right?
Yeah.
And then I'm trying to relearn that, and I'm trying to recalibrate and say, wait, I really do have to, and well, as I learn to enjoy this process,
Yeah.
I have to start celebrating these small goals and saying, oh, wow.
Well, that's what you did the other day with the thing on the that you put on your story in the shower or whatever that you wrote down.
Oh,
on
yeah.
Yeah, you wrote down on a whiteboard like all these are the new goals or whatever.
Yeah.
But you sit back and you take that time and analyze where you've come.
But I
couple
think
of
that's
posts
what
like that.
happens to a lot of people. I think
Yeah.
a lot of people, even when it's talking about on their fitness journey, on their weight loss journey, or on their recovery journey when they're recovering from an injury, I think we don't see how far we've come. We always fixate on what we haven't regained or
Yeah.
where we have not gotten.
Correct.
And it could be motivating too. So
Yeah.
I could look at it from a positive perspective,
Mhm.
but I think it's also for longevity and sustainability. I think it's really important that we maintain that perspective of look how far you've come.
Of course. And you have to look at what is that person's motivation, right? Do they get motivated by looking for that last bit to get them to keep on pushing? Or is that last bit something that's hindering their performance because they're still seeking it and they can't get to it and they feel like they're never going to get there? And so why even like talk about it? So as a practitioner, you have to kind of just see what makes them tick. And if it's a positive feedback that they're getting from how much more can I attain, or is it a negative feedback that they're getting that they're never going to be able to attain it, then you can kind of guide your words much more carefully. I do this stuff kind of like without thinking about it after being in the profession. But I think when you're first starting out, you really have to be careful with the words that you use. And the same thing goes back to the fitness instructor. Be very careful about what you say, because not everybody's going to take it and use it as motivation.
Yeah, they might get offended by
100%.
by what you just gave. Like you gave strong criticism or told them that you're not going hard enough. And
Correct.
you
And you have no idea that 4 weeks ago, they couldn't do an 8-minute mile and they were struggling with like an 8:30, and that's a huge accomplishment. And you just crushed their dreams by saying 8:0 or like 8 minutes wasn't fast enough.
Yeah.
I want to see you do 7:45, but you forgot that they were like 6 months ago, they were at 10-minute mile. Like, yo, you just crushed somebody. So be careful with your words because they hurt.
Yeah. And not only that, you might be looking at their effort level, and in your eyes, they're at like a 6 or a 7, but what they're feeling is a 10. Like they're pushing with everything they have.
Correct.
And maybe you see more potential in that person,
Yeah.
but they don't see it in themselves yet. So they're not ready to make that jump. So you can't get frustrated. And this can go for children, for relationships, for a lot of things. You could see the potential in your partner and your child.
Yeah.
And you can encourage them. But if you use the wrong words, you may just crush them. You may just completely
discourage them
and discourage them from actually moving forward.
100.
So I think that's huge. There's so many things that play from a physical perspective to a mental perspective. So how much do you find a patient's mental state and outlook on their injury affects their progress and recovery?
I think PT is all mental. It's a lot mental.
Why do you say that?
Because there's so many things that go into someone trusting you with their care. Number one, do they believe in you as a practitioner? Do they believe that you have their best interests in mind? Did you set out a clear plan for them to follow? Did you come up with a plan together with them? Or were you just telling them what they needed without their input at all and kind of just like blew off the eval and that's it? And, like, this is what you need to do. Like, just come back to see me like a couple weeks, Sorry, ask the question again.
Hold on, let me see.
Yeah, I got thrown off. I was going.
No, it's how much do you find a patient's mental state and outlook on their injury affects their progress and recovery?
Yeah, so directly correlated. If they have a negative outlook on what it is, I always go back to the same low back pain. People have this huge apprehension to feeling anything in their low back. Anything in their back and their spine.
Because they fear they're going to throw it out again, or?
Yeah, they feel like and the back is connected to so much, or they have somebody who has a bad back. Like your back is super strong, a lot more strong than people think that it is or give it credit for. Whether or not that was something done in the past to promote back surgery or whatever it might be, or whatever kind of Machiavellic thing it was, I have no clue. But there is this notion that anything in your back is bad. Mm-hmm. Any kind of low back pain is bad. So when someone feels low back pain, they say, oh, sciatica, like sciatic pain. Like, no, not really. You have pain in your piriformis. Like, we can stretch that out, or we can work that out. So if you're able to take somebody who sees this low back pain as like a huge problem and mitigate it to like that, or mitigate it from this to this, and kind of bring them back down to earth, then you can guide that plan of care better. But if you can't take this problem and turn it into this, you're going to have a really hard time, because look how small this like scope is here and how many objections I can work with here versus here. They always have something to grab onto, which is very difficult for you to work with as a practitioner. You can't someone's always going to try to find a way around what you say that's positive, because they're always going to have this huge scope to draw from. But let's say sciatic pain, like, no, you don't have sciatica. So that takes away that possibility. Let's say it's a fracture. Oh, you don't have a fracture. Boom, that got narrow. Oh, let's say it's a herniation. Oh, I just did these 3 tests or this cluster of sets. It doesn't seem like a herniation to me. Boom, boom, boom. It's just a facet issue. Let's work on this facet issue over the next 3 weeks. Anything that you see in pain and discomfort, this is kind of where you should be feeling it, if anything. Boom, I got them here. Mm-hmm. Like, I took their mind out of it, their craziness, their friggin' Instagram feed that's telling them all these 80 different things, their WebMD, whatever it is. I brought it down. Boom. And I can control it now. I can control the narrative.
You said something interesting a second ago. You mentioned our back. It's true. It's true what you said. Our back has been almost marketed as this very weak point in our body. Mm-hmm. Where did that start? Like, right now is when I'm starting to see people do a lot more with back curvatures, right?
We've always been told flat back for everything. Core tight. What is your core, bro?
Everything is my core.
Yeah, exactly.
But why? So is it okay for me to arch my back as I'm doing certain exercises?
Well, to arch or to arch?
To arch.
So injury is, in I guess my definition, a lot of certain PTs that have the same mindset as me say it the same way. It's like a tissue that wasn't ready for the load took the load. Pause. So let's say yeah.
That's what she said, joke, or something.
100%.
Can you repeat that statement, sir?
So I guess I'll just put myself in this, and I'll take all the practitioners out.
I wouldn't put yourself in that one. I would take yourself far away.
Completely out of it. So an injury is, let's use scientific words. A tissue that doesn't have the capacity for that specific workload.
Okay.
took on that specific workload.
So it's
It got overstretched. It got overly stimulated, and it wasn't able to do its job. All right, and so what failed? Was it the tissue, or was it the technique?
Mm-hmm.
Did you use an improper technique in lifting? Did you not properly load that tissue in its infancy, for lack of a better word,
Mm-hmm.
in its when it was first starting to take on that workload
Uh-huh.
or that weight? And if you did properly prepare it, then it might be a technique situation. If you have terrible technique and you have bad tissues, then you're just like, it's a recipe for disaster and more injury. So figure out what tissues messed up, figure out what caused the mess up to happen. But there's certain people that deadlift with completely rounded back, but their posterior longitudinal ligament can hold all their vertebra.
Gotcha.
You know, like it knows how to handle that stress. Most people are sitting down, are not loaded, and then you tell them to go do a CrossFit class or go do an Orangetheory class, and deadlifts are in the program, and they go into a load with bad technique and they lift out of that load, and you get a little posterior lateral herniation.
Mm-hmm.
And herniation, that's a no-no word. You don't say that because people take hernias and they turn that into back surgery. They turn that into like huge problems.
Mm-hmm.
Herniations happen all the time. And your body just kind of learns how to bring it back.
Yeah, when you started talking about tissues and loads, I know this podcast keeps on taking weird turns. But seriously, do you find that many people that you treat are affected mentally or emotionally from their physical injuries?
Yeah, because so a huge part of my treatment, especially in the cash pay realm, you're dealing with people that aren't acute, right? So like most people aren't post-surgical. They're not coming off of an ACL or something like that. They're coming off of more like phase 3, phase 4, to where they're pretty active. They just have like this lingering pain, or they have this like lingering discomfort, or they have this repeated discomfort, or they get these calf injuries like you were talking about. And it's just stopping them from doing what they like to do at their 100%. So that's kind of like my niche. It's like, what do you want to do? Where are you now? What's stopping you from getting there? Let's fix it. And I can provide a plan going for the next 6 or so sessions or 6 or so weeks, whatever it is, and we can figure it out together and take away, not take away your activity that you love, but let's modify it a little bit for the time being. Continue to do what you want to do and you love to do, and you can stay with that positive reinforcement while we're working on this issue.
I think it definitely has to do a lot with the patient trusting you, simply because I mean I've experienced it.
Yeah.
4 or 5 weeks ago when we started PT,
yeah.
I felt that fear, right?
Yeah, of
and
course.
you were like, no, if this tears right now, it's because your surgeon sucks. Shout out to Dr. Steve Mora. He's awesome.
Hasn't torn yet. Hasn't torn yet.
It's not going to tear.
Yeah.
But I know that initially, and I started using this analogy, and I think I wrote it yesterday or whenever it was, where I saw this commonality with physical injuries and emotional injuries.
Okay.
And you have this physical injury, and all of a sudden, as I'm trying to rehab it or repair it, I'm not going to use its full strength or its full range simply out of fear of re-injury, right?
Sure.
And so you tend to guard it. You don't let people touch it.
Yeah.
You don't take it to its full capacity.
Yeah.
You limit it. You limit its ability to protect it.
Yeah.
And so then I was like, holy shit. This is the same way we are as humans.
Yeah, you're actually right.
From an emotional standpoint, a lot of us suffer from either emotional trauma, whether it's in childhood or adulthood, whether it's in our love life, our financial life, just in general.
They call it putting up walls.
Yeah, so we start putting up walls. We start guarding the same way that you guard an injury. Like when you first started pulling on my arm,
I didn't do it that aggressively.
No. But when you start pulling on my arm, right away, what do? I clench.
Of course.
I bring it in.
Yeah.
And I want to protect and guard it. Yeah. And so what I started to see, I saw it, and I've seen it in my patients. I've seen it in myself, where I have had these emotional injuries throughout my life, and you don't realize until you start looking. You have to really look at that injury and focus on it, and start saying, "Oh shit, I'm limiting this ability. I'm limiting people from entering my life."
And you're enjoying your life more, possibly.
I could be enjoying it more if I would allow them in, if I was vulnerable, right?
That's hard.
It's hard, though.
Yeah.
But just like PT, physical therapy is hard because now I have to trust you
Yeah.
to help strengthen this injured part of myself.
Yeah.
Right. And how do I don't know. I just found it interesting.
So what kind of clicked in it for you is trusting me as a practitioner, right? Go back and
Definitely
analyze you in general. Like you came in with this guarded injury, and then within that first session, you let me take you through ranges that you hadn't seen before or in a while, right? So what did I do in that session when I saw you? When you were guarded, did I say, relax?
No.
Calm down, bro. I got you, bro. Don't worry, bro. I didn't say any of that, right? Like, so I kind of shook around your arm a little bit. I worked into the tissue a little bit more. Like I started opening you up slowly and surely. And before, like you knew it, you were all the way out here, and like looking like, what am I doing out here? But you're out there. Yeah. Like, and I'm working with your arm. Simple. I put a lot of my body on your arm. So I was holding your arm right in here. You felt my warmth. You felt my warmth.
Yeah.
You felt.
I'm okay.
We're going back.
Listen,
we're going back to the tissues. We're going back to the load.
I'm okay with feeling the warmth, not the load. Let's just make that clear. Go ahead. Continue.
So you felt the contact, right? And that kind of let you bring your guard down a little bit because your arm felt safe. If I would have held your wrist, and I just had 2 points of contact, like just your wrist with one hand, and I was pushing into and doing mobilizations with my other hand, and you only had 2 points of contact, you feel very unsafe.
Yeah.
You're going to stay guarded. So these are things that you learn some in PT school, but really when you go out into practice and you kind of figure out what people need to get them to do what you want them to do without telling them to do it.
Yeah, because it's a sense of security. Like, okay, like I can't really describe it, but I know that I felt much more comfortable. It's simply because you were bracing my.
Yeah, it's a warm embrace.
Yeah, you were bracing my arm.
Don't make it less than what it is, man.
Man, I quit. Hold on. So what's I'm gonna keep going. So much of your job centers around the care for others, right?
Yeah.
How does this take a toll on you? and what do you do as an outlet?
Oh man, I sometimes my job has a lot to do with listening and reacting. Every day is different. I could have the patient that was super, super happy for 3 weeks straight, and 1 week they come and they had like one of those issues where like, oh, I felt it over here, and they feel like they've made 8 steps back, and I have to be able to troubleshoot and put out that fire. So that takes a lot of like mental kind of emotional stress. So I think after I do maybe 5, 6, 7 sessions in one day, and these are all 1 hour sessions, sometimes 1 hour 15, I go home and I'm kind of beat. Like I don't want to talk. I just want to like sit there. But then my wife will come home and she'll want to talk. Not in a bad way. It's just, she doesn't talk to a lot of people throughout her job. So she's on the computer, she's answering emails, and she talks here and there, interacts. But it's hard for me mentally to gear that back up and talk. So I like to listen. I'm very quiet when I get home. That's something I've been working on. But my outlet, I would say, is like volleyball. Like my outlet is going out and being physical, going out and being in the sand, rolling around. Like it's fun. I just get to do that and don't have to talk, but I can if I want to. That's pretty much it. Because I would say that like I would lie to you and tell you that I'd go out for a long walk or something like that. I don't do that.
Yes, no, but that definitely takes I think anybody who is a healthcare provider finds, or anybody who's in the helping profession or even customer service, I would imagine.
Yeah.
You spend your day engaging with the public, talking to people, explaining yourself, using communication, trying to be as thorough as possible. And you get home and it's like, it's heavy, right?
Yeah.
And it's kind of your time to just mellow out and escape.
Mm-hmm.
Now your wife gets home. Women naturally talk more either way.
I didn't say that.
She's full of energy.
I didn't say that.
She comes home full of energy, and she's probably so excited to see you. And then you've
some days.
But you've given a lot of yourself while you were at work.
Yeah.
And now she's asking of you.
Mm-hmm.
How does that? Yeah, how do you sift through that? How you said you're working on it now, but how do you sift through that in terms of like how do you
It's
accept
a learning
like,
curve. It's a learning curve. I understand that she doesn't understand a lot of the aspects that go into my job, and I I take that into consideration, and I try to just be more energetic. I try to, when I don't want to say anything, I'd say something. I don't know. It's tough, but we make it work. It makes sense.
Yeah.
I don't know how to explain it. It's just she understands that aspect of myself, and she's asking for more initially when we were together, and I give more now because I know that's what she wanted initially. But she understood that I do when I have a long day. It's a lot of talking.
I think it goes back to just communicating that, right?
Yeah.
Had she not
had to talk.
Yeah, had she not told you, hey, like you're shutting down when you get home, had she not expressed that to you, you probably wouldn't have responded. But since she pointed that out, but then you also probably expressed.
She never
like,
really like communicated that way. It's more like you don't talk a lot, and it's not like in a bad way. It's just like I don't talk a lot. Yeah, because my job involves me talking for sometimes 6 hours, 7 hours a day, and it's a lot to deal with problems, emotional problems with people, and PT is a lot of psych. I wish we were more prepared for that, but yeah, PT is a lot of psych, and yeah, so the fact that she mentioned that and dropped that hint, like I'm not gonna just completely neglect it. You know, I take that into. That goes back to the upbringing. Going back to like when we first started this podcast, you asked me about my childhood. It's a lot of inferring. I grew up in a house of 3 women, and a brother, but it's a lot of inferring what they say and reading between the lines because we weren't the best communicators with that. And that's kind of how I took her small comment. It's like, oh, you don't talk that much. And I'm like, okay. I gotta talk more.
So who helped raise you?
My mom, my aunt, and her mom at the end. Like it kind of when I was living there by myself, it was M3 because my brother had already left.
Your dad had left. Your dad wasn't part of your upbringing.
Correct.
Was that difficult for you as a man?
Not really. I learned how to be a very chivalrous human being. Like, I learned very quick that I had to be on point with everything and understanding women because the 3 women in my house, they all worked differently. They all have different things that make them tick.
Gotcha.
And different things that tick them off.
So you learned very quickly like how to win. How to win over the ladies.
Yeah, my wife is not that way though.
No?
My wife is unlike them 3. So it's a learning experience. It's a day in, day out learning how to make her happy every day, which is enjoyable.
And how long have you been married?
A year and some change.
A year and some change. That's awesome, man.
Yeah.
Congrats.
Yeah. We've only known each other for 2 years, 2.5 years.
And I know she kicks your ass on the bike.
Yeah, she does. And I'm very proud of her for it.
Yeah. So are you still into bike? Do you love biking?
I haven't touched the bike since my half-ironman. March 20th. So was literally, the bike is collecting dust.
What geared you to train for a half-ironman? Because I think once upon a time in my mind, I thought I was going to do it. I did a few triathlons.
Yeah.
But then the more I realized like the training that's required for a half-ironman.
Yeah.
Can you just tell me what a half-ironman consists of in terms of mileage?
Yeah.
So people understand what a half-ironman is.
Yes. A 1.2 mile swim. It's a 56 mile bike ride and a 13.1 mile run.
All right. So let's break that down a little bit more. How long does a typical, on average,
like a
1.2 mile swim, how long does that take somebody like, are you an avid swimmer? Did you learn?
I'm a terrible swimmer. I learned how to swim in January.
So how long
did
the
swim for distance in January?
Okay. How long did the swim take you?
53 minutes.
50. So almost an
I'm a terrible swimmer.
So an hour swimming, basically, you get off.
Yes.
Was there a wetsuit?
No wetsuit. That was Puerto Rico. Puerto Rico. It's Condado.
So the water's,
in the lagoon.
The water's warm.
Yeah, the water was fine. The water was turbulent.
Oh, that's
very turbulent. Yeah, it was rough. It was at one point. So we crossed under the bridge to get to the place to come out of the I guess what that's called, the checkpoint. And I was swimming and a wave came by and I got lifted up in the wave and then crashed on top of somebody else who was swimming under me.
Oh.
Like that was kind of like what we were dealing with when we got past that bridge. And then there was a current. But
when you were did you train in the pool or did you train?
No, I trained in Key Biscayne.
Okay,
yeah, Key Biscayne is like the tri-beach.
But it's not choppy though. It's a bay.
It's choppy. It can be choppy sometimes when there's wind, but it's not that choppy.
Well, that was the mistake.
That was rough.
When I trained for a triathlon,
it
was a sprint. I was training in a pool.
And you did an open water swim.
And it was an open water swim in South Beach.
Yeah.
It was a South Beach Nautica South Beach.
Yeah, I
triathlon.
did the last small triathlon that I did was Nautica South Beach back when it was a classic distance, and it was back in 2011.
Yeah,
that was the last triathlon that I did.
Terrible.
Yeah, but for me, thank God, open water swim, glass.
So open water swim. How long is the bike again?
The bike was 56.
56 miles.
Yeah.
How long does a 56 mile bike ride take?
If you're good, if it's from here to Black Point and back to where I live, it's like 2 hours and 15.
So you've
like
swam for an hour. You get on a bike for 2 hours.
That was 2 hours and 2 hours and 30 minutes.
Can you describe how your legs feel? So the next is you go from a swim to a bike to a run. What do your legs feel? What do your legs feel like when you get off the bike and you start to run? You feel like Bambi. You feel like your legs are trembling.
Yeah, I was like, I can't believe I'm about to run 13.1 miles.
So now you have a half marathon ahead of you.
But it was Puerto Rico, so it was a half marathon, but it wasn't a half marathon in Key Biscayne. It's
hilly.
It's a hilly. It's described as hilly on the Iron hilly on the Ironman circuit.
And how long did that take?
That one took me forever. That one took like another 2 hours. Another two and a half hours.
Okay, yeah, because if you just run a fresh half, like a 2 hour pace is like a 9-minute pace.
Yeah, it's not bad.
Yeah, which is an average.
Well, going back to, I said, yeah, it's not bad to someone who's never run 13.1 miles before and they did it in 4 hours. Like, fuck yeah, good.
Yeah,
awesome.
Congrats.
You did 13.1 miles. Huge. That's great. Yeah, you have to take into consideration that like if you're not in the realm, running a 13.1 mile marathon half marathon is that's what the active guy at work does, in a regular work setting. But if you're in the triathlete world at 13.1 or in the Ironman world at 13.1 is like, that was like my short run throughout the week. I'm doing 26 like this weekend. Like it means nothing. So like take it into perspective. But yeah, 13.1 after doing all that in 2.5 hours is a lot. And I hit up like multiple walls throughout that run where I had to just walk and get through it. Like mile 10, you think you hit mile 10, I'll just run a 5K. Like when I get to mile 10, I'm going to run a 5K and I'll be done. I've done 5Ks before. Like I tried to shorten it into things that I've done in like digestible pieces. I hit mile 10 and I was like, I can't run. I can't do it.
You can't. You're done.
Yeah, like I would try to go and then my body was like, nah, just walk. You'll be fine. And so I did that. I like bartered with myself. I'm like, if I'll walk to mile 11, I'll give you a 1 mile walk and then you just have to run.
Actually now we're talking about this. How do you feel about people? Because this is something that I've thought about a lot. For my body type, running a full marathon is probably asking for injury. Simply because I'm 185 pounds.
Were your tissues ready for the load though?
No, my tissues were not ready for the load.
Okay.
This is what the title of this podcast is going to be. Is your tissue ready for the load? So wrong. The visual is
taken out of context. That'd be
Polo's
very
a graphic
bad.
designer. He's already working on the design back there. It's terrible.
So
I don't know how I'm gonna feel about listening to this later on. I'm gonna laugh. I'll tell you that much. But yeah. So do you feel that is an intelligent goal for, let's say, a 40-year-old individual who has been relatively sedentary, and all of a sudden they get this bright idea like, I'm going to do a marathon next year.
Yeah.
Is that a wise choice?
If your body's prepared for it, yes.
But do you think they could prepare for it, let's say a 10 months or in 1 year? Can you prepare those tissues for that level of exertion?
Off of a no cardio, like no base, nothing, nothing
right.
at all.
Because a lot of people do it. That's why I'm saying
Yeah. I would say give yourself a year.
At least a year. Yeah,
and it's got to be like you got to build a cardio base that doesn't involve running. The cardio base, because if you don't have a cardio base, chances are you don't have a strength base. So build a cardio base on something that's non-impact, like a bike, recumbent bike, whatever works. And then once you have that cardio base to where you can maybe jog or something like that, then go and build the strength base, or build the strength base while you're doing the cardio. And then go from there.
So this is a very slow, methodical program.
100%.
That somebody would go into gradually. They're probably going to have to address small issues that arise as they train.
Yeah, muscles, tendons, ligaments, bone. They all have kind of different healing times. So like when you're sending somebody to run, you get like small fractures in your shins, and you build that up over time. Your body learns that, hey, I'm gonna get this impact, so let me like rebuild this area with like osteoblastic activity. Like I'm gonna rebuild this bone so it's stronger, it's fortified, it's ready to take on that impact later on. You have to give your body time for that to happen, but people don't. They'll say, hey, I want to go to do this marathon. I'm going to do it in 4 months. And then they try to run every single day. and they end up getting these shin splints, right? And like shin splints is the worst. Like you have to stop running and let them heal before you can go back to it. And then they get them again because all they did was let it heal, and they didn't address the lack of strength, or they didn't address the weight issue, because it's a lot more weight hitting you down when you weigh more. That seemed obvious to say.
No.
Yeah.
I just feel that a lot of people start setting those goals and they want to run these big races because it's almost like a milestone for them.
Yeah,
but
and it should be. I mean, it's a great milestone to hit. It's great, but the expectation is where you have to understand, like, your body needs time to adjust. You're not gonna just think that you're gonna get to that goal by running an hour a day or running the long run later on. You have to prepare for other things outside of that. I get that a lot with active adults or people that like older men that go and try to play soccer or try to play basketball or something, and they pull a hamstring, or they, twist a knee in one way or another and get like a little meniscus tear or something, or get some irritation in their knee. They come in and I'm like, so what's your strength training like? I go to the gym and I do like some bicep curls and I do some chest press and I do some lat pull down. I'm like, okay, so what do you do for legs? I get on the treadmill and I walk. Okay, so you were an athlete back in your day and you think that you can continue to do that, but you're not training to do that, and you're asking your body to do that. Your body's going to do what you're asking it to do, but it's not prepared for it. So this is what happens. You twist your knee because you haven't done cutting in 20 years and you tried to cut because you had that distant memory of what it felt like to cut. So what do? We have to rebuild the strength in the knee or the hip or whatever it is, and then from there take you into cutting drills that are very controlled. And now you know how to cut. Now your body knows what to do when to cut. Now you're going to do that on turf. It feels good, feel comfortable. Cool. Now you're going to do that with a ball. Okay, and then like you slowly progress that to where they feel comfortable cutting. And that's kind of what it is. You have to kind of like reverse engineer.
Yeah.
What's the goal that you have, and then what are you lacking to be able to do this? A lot of people, it's just like that's sport-specific training, or even just sport-specific strength training that they need to do to get them to be stable. And that's what you're not going to get from doing something like an Orangetheory or something like a group fitness class, because you might get the cardio conditioning, but your sport is asking you to do this, and your training regimen is not doing anything close to that. Your heart might be able to take it, but your body does not know the movement pattern. You're not going to do well in this. Stick to your class.
Yeah, that's why my pec exploded. No, seriously. I had been doing the same HIIT training for a while. Mm-hmm. I felt strong. I felt good.
Yeah.
I put too much load on the bar. I was in Mexico.
Careful.
I was in Mexico City, and then all of a sudden I'm bench pressing, which I felt strong enough to do. Mm-hmm. I was pressing 275 on decline. And it was like my fifth set. I hit the record button to send my friend. So be like, hey, high school weight, bro. Still got it.
Yeah.
And
still had it.
And next thing you know, boom, it felt like a Velcro exploded in my
like
chest.
ripping apart. Like
literally the best explanation is just like a very strong Velcro that just sheared right away. Shoot. And then no pain immediately. Sat up. And the video is great.
No, you said I tore my pec.
Yeah,
you said
I tore my pec. My muscle just exploded in my chest, and I'm just sitting up looking at the guy. But then you look at a picture from 15 minutes later.
Black
it's
and blue
starting to balloon.
Yeah.
Over the next couple of days, it's just black and blue across. It was pretty bizarre. I mean.
Yeah. I mean, it's funny because like I've been through certain injuries before. Like I haven't torn my ACL. I haven't really torn my rotator cuff. None of that stuff. I help people rehab through that. I've hurt my low back before. And I've also I've dislocated my kneecap. It's funny to hear people's descriptions of what's going on, because then you can use that too. Right. So if someone ever comes in and they think they tore their pec, I'll be like, hey, did it feel like Velcro was coming off like quickly, or did it feel like it was just like partially off?
Yeah.
So I can use that as a descriptor.
No, immediately. It was just boom.
Yeah.
It was pretty rough.
Honestly,
the weirdest part about having that sort of an injury where I literally have a piece of my chest that's no longer there.
Yeah.
Is just that. Like I started to realize not body dysmorphia, but just like having a deficit. And I'm not going to freaking let's say somebody who has an amputation, it's something that it's very apparent.
Yeah.
You're missing a part of yourself and every day you touch it, right?
Yeah.
or maybe a woman who had a bilateral mastectomy because they had breast cancer or something
that
like
messes
that.
with your brain.
And all of a sudden, every time you touch, it's like, oh wait, I'm not whole, is what I feel like sometimes. And I'm speaking for myself.
Yeah.
I can honestly say there's not one day that goes by that I don't touch the site of the injury and realize like, oh, this isn't what it once was. I'm not saying like I'm sitting there crying, but I definitely recognize that there's a deficit.
Yeah.
And I could see how it could get into your head.
Yeah.
I've learned to work past it. I'm trying to strengthen it.
For sure.
But I definitely still, especially right after the surgery, when I would see dudes doing dips or on Instagram, I would see somebody bench pressing.
Yeah.
And does one of two things. Either I'm cringing because I'm worried about them.
Yeah.
Or it's like, damn, I want to do that again. So.
Gotcha.
Just a few more questions for you before we go.
Oh wait,
no, go ahead.
It is 3:00. I have a patient at 3:30.
Oh, no worries. No. We'll,
I do want to come back. Though.
Yeah,
and,
no. We'll
finish this
close it up.
conversation for sure.
I think no, just to close off.
Yeah.
Let me see if I have at least
Sorry.
one more good one. No, you're
No
fine,
worries.
dude. Patience come first.
Patience comes first.
That's true.
Both.
I guess the last question I'll ask you is you've been in the fitness. I was gonna ask you like about glute camps and the best.
Oh my god!
But no, I'm not gonna go there.
We can go there for sure. Just
go ahead.
No.
Well then.
I need more time.
All right, no worries.
I want to come back for a second.
All right.
At some point.
But
Yeah.
I mean that's fine. That's a good way to. Is there anything you want to share before we go? How about that?
Yeah. Man. That's a very open-ended question.
Yeah.
Yeah. Don't let the best form of exercise stop you from exercising, right? Like don't get caught up in the minutia of like, I have to do HIIT training. I have to do this style of training in order to see the best results. Who cares about the best results? Like go do something that involves movement so you can start somewhere. If you're literally stopping yourself from going to do anything because the class schedule doesn't work for you, like you're just looking for an excuse not to move. Like just go and move because movement will bring you other things, right? And we talked about that before. We can get into that later on about that book. But don't look for excuses. Look for solutions, and the solution is movement.
And that's what I've been preaching, man. I just want people to move. I want people to get outside. I want them to realize like whatever limitations you think you have, use what you can do.
Yeah.
Like I've been injured. I've been hurt before, and I'll find something else to do.
Yeah.
So
boxing might not be your first choice when you've tore your pec, but hey, guess what? I'm going to go walk. I'm going to go bike. I'm going to do whatever I can.
So yeah, I guess that's the main thing is get people to move, get outside, enjoy life, enjoy your quality of life, improve your quality of life.
Yep.
And a lot of that is going to stem from movement.
Of course. Definitely.
All right, Juan.
Yeah.
Pleasure to have you.
For
Seriously,
sure.
I mean it. I appreciate you not only as a guest on the podcast, as my physical therapist,
There we go.
as a clinician, as a human, and as a friend, bro. So thank you. Appreciate it.
Oh, of course.
All right, man.
Yeah.
Thanks a lot, Juan.
For sure.